Right. Hello, good afternoon to everybody. Thank you for joining us today. We're going to take just a minute to get some links set up for everybody so that you guys can have access to some of the resources today during this Facebook Live Lunch and Learn. And we have some time to let folks join in as they get their notifications here on Facebook. Keep in mind that we are also on YouTube, so we're going to have this video as well on that later this afternoon. So bear with us one moment. We're going to get everything up. We hope everybody's doing well and looking to go into a great weekend here. All right. Well, thank you everybody for coming in. Just be one more moment while we're letting folks join us. We're going to get some links up here in the chat. And while you guys are in here joining us, feel free to give us a like, share this to your news feed so other folks will get notification that this is going on. We're going to make sure that any questions you guys have will be answered today if time permits. So feel free to put your questions into the chat box today. And as we go through our conversation on the topic, we'll try to get those into you as well so we can answer them live for you. It's just taking a little longer for my chat box to show up. So bear with me, everyone. I appreciate your patience. Well, it's taking a little longer to do it, but so we don't delay it, we'll go ahead and get into the conversation today. I'll make sure we'll get the links still up for you guys here in the chat. So again, good afternoon and welcome to another Facebook Live with the Center for African American Health. We are, as a note, we are hosting another COVID-19 vaccine clinic tomorrow. That's Saturday the 29th. At our building at 10 a.m. to 1 p.m. We'll have details in the chat on the location. Keep in mind that with these vaccine clinics, there's no ID that's required. No insurance, we don't ask about immigration status. Walk-ins are welcome, and there's a $50 gift card that will be offered with each vaccination. Again, we'll have more information in the chat box for you. We'll also have information on how you can contact us if there's any questions you have about the event itself. Also, please join us on February 12th, that's a Saturday, for the first installment of the I Am a Masterpiece series. It's an extension of our 20th annual collaborative health fair. Normally we have these as a single one-day in-person event. This year, we are splitting it up into different installments, make sure that they're accessible and they're mindful of everybody during this time with the pandemic going on. So during this in-person event, it's going to be, again, at our building, just like the clinics are. We're going to partner with different healthcare providers who will provide different prostate screenings and women's mammogram screenings, all free of charge. Feel free, you're welcome to come. There's going to be a variety of different information and resources as well that we give out during the event. So as everybody's joining, I'm going to go ahead and introduce myself and tell you a little bit about the Center for African American Health. My name is Eric Moore. I'm the Director of Advocacy at the Center for African American Health. And for those of you who may not be familiar with our work, we've been in the community for more than 20 years with a focus and commitment to improving the health and well-being of the African American community. Again, as we move through today's session, feel free to type your questions in the comment area here on Facebook, and we'll address them as time permits. So just want to do a brief introduction today. I'm joined by our community partner, Alliss from the Families Forward Resource Center, to discuss the state of Black breastfeeding in Colorado and to expand on the findings of a community assessment we conducted starting back in March of 2021. Before I introduce Alliss, I want to ask Alliss to introduce herself and her role at the at Family Forwards. I want to briefly explain why the assessment was necessary and how that information will be used to improve breastfeeding outcomes for Black families in Colorado. So as many of us know, disparities around breastfeeding rates among Black and African Americans in Colorado are attributed to a variety of longstanding and enduring factors. And these are things that a lot of us are familiar with or maybe not so familiar with. But they include the longstanding trauma of American slavery, medical racism, variety of different systemic and structural barriers that are found along the different social determinants of health, and the lack of diversity in the lactation field's workforce. Back in March of last year, Center for African American Health, Families Forward Resource Center, and the Colorado Department of Public Health and Environment came together to leverage our unique organizational strengths and to conduct a community assessment to better understand the factors, barriers, and facilitators of success that contribute to the breastfeeding outcomes for our families here in the Metro Denver area. These findings were published in a report back in October, and that's something that actually we'll have available on our website shortly. With the report, it's to help us share what the experiences of community members are when it comes to breastfeeding practices and their experiences in the healthcare settings, also at the community level, and then what the impact of the healthcare providers who contribute both to the solutions and to the issues that affect having healthy breastfeeding practices and having access to these services. We hope to see changes in how we advocate using this information and further research going forward, and how providers conduct lactation services and care that will ultimately improve Black breastfeeding. So we'll jump into with my co-host here. So welcome, Alliss. Thank you for joining us, and thank you for your patience with the delay at the start here. Please tell us a little bit about your background and your role at FFRC.
All right. Hello, everyone, and thanks for thanks for having me. My name is Alliss Hardy, and I work for Families Forward Resource Center. I am the lactation program coordinator. And so what that means is I'm basically in charge of making sure that our programs meet our breastfeeding benchmarks so we can decrease the disparities in the Black community. That's with our Healthy Babies, Strong Families program. I also make sure that I am educating the participants in our program about breastfeeding, also educate my coworkers on the importance of pushing forward their participation in lactation support one-on-one and classes. And just recently, I was able to get Families Forward certified to be a breastfeeding friendly workplace. So all the things in the community that involve breastfeeding and decreasing disparities and making sure our Black families are supported. I do that. I'm a certified Black lactation educator, a lactation counselor, and just overall lactation specialist. And so, yeah, it's really important work, and I'm just excited to be a part of it. So thanks for having me.
Thank you, Alliss. It's a great summary, and I know we'll talk a lot more about what this work has been. Together, we worked on a lot of the research aspects of this project, and I know you bring a wealth of experience because you interact with families day to day. And in this project, I just got a sliver of that experience from usually in my work. I don't get this close up and personal with community members, so I know that you'll bring a lot of good information about what it is that really is affecting us. We do like to start these Facebook Lives with some icebreakers. So one thing we did want to ask was, talk about really was, during this process, we conducted interviews, we got information from surveys that helped us understand a lot about what organizations could do as their next steps. So Alliss, I wanted to ask, was there anything that you discovered during this work that you maybe didn't already know, something that maybe surprised you?
Yeah, when I was conducting the interviews, there was an overwhelming response to, one of the questions is, did you receive any lactation or breastfeeding majority, well, everyone said yes, like directly after delivery, they tried to do the initial latch, but when it came time to leave the hospital, some said no, they didn't get any information. And then some said they were just sent home with like a pamphlet, like here's a hotline to call, but not a direct person, not a direct organization, not a specific day and time that they could go to get support, like through classes or anything like that. So it was just surprising to me that that it's like they're checking a box, so the support is offered, but there's really like no follow-up after they do the initial latch. And it's really disappointing.
You know, it's funny because the thing that surprised me falls in line with that, right? It's this idea of how healthcare providers might perceive they are interacting with community members, making sure that they get what they need, and then the actual outcomes that community members report back out and the experiences they share with us. And that's something that's classic with particularly Black and African American community. We hear a lot of differences in how we are treated when we get to the healthcare settings, how follow-up care is done, even care coordination, how we're referred to different providers. There's all these differences that we know it contributes to the disparities and like what we get and what we need and being heard in that process. So for me, it's the same where when it came to providers, they had such a high level of confidence that I'm checking off all the boxes and making sure everybody knows what they need to know at this moment regarding their care, their diagnosis, prognosis, what to do going forward once you leave my office. But patients are saying opposite, where as high as that kind of, I guess, that confidence level that providers have, that they're doing everything they need to make sure that the patient's cared for. And that's something that I guess surprised me because we saw numbers, here a lot of times it's anecdotal. People will talk about how the provider acted and what they really got at the end of it. But doing the survey, we got more hard numbers on seeing how providers view themselves, how community members view the experience. And you see that big gap where you're like, wow, it's like, it's something, it just makes it more real for me when I start seeing it in a different way, because we've always seen that qualitative piece, people speaking to that experience.
Right.
I'll go into the project background, a little bit of an overview. We talked a little bit about why we needed to do this project in the first place. So I'll say with our project team, we understood there's two key underlying challenges to increasing Black breastfeeding rates in Metro Denver. Number one is that Black and African Americans, individuals of color, are dramatically underrepresented in the lactation field itself. And two, that healthcare providers often lack awareness of the breastfeeding disparities and the need for additional support for our communities. So what the project team did here is that we defined a goal. And our goal was to improve the understanding of Metro Denver's breastfeeding landscape from the provider and the community member family's perspective. And on top of that goal is to assist organizations and individuals in better advocating for policies and practices that will support our families going forward. And that's really what the report was, the culmination of all that work was to create some kind of deliverable that now we can use to create more conversations with organizations that, like yours and mine, we're now breastfeeding certified organizations as a city and county of Denver recognizes it. And really being able to advocate for what are some internal policies that others could be doing, what are some things community members could be doing to advocate and pushing for certain things to be changed when it comes to the healthcare systems, and even at the grassroots with organizations like ourselves. So what we did in this work was that we did, like I said, we conducted self-assessments of our organizations. We're proud that we got certified by Denver Department of Public Health and Environment as we're recognized as a breastfeeding friendly work site. And then two is that we created the report by conducting two forms of data collection activities. We did both online surveys and key informant interviews. So now, for the audience, just letting you know that Alliss and I are here because we were the ones who helped with doing the bulk of these two activities. So I'll talk a little bit about the online surveys first, and then Alliss, I'll hand it off to you to talk a little bit about how the interviews went for you. So for the online surveys, we had three audiences. We had healthcare providers, lactation support providers, and pregnant and postpartum families. So I will say, as a note between the healthcare providers, you might say, what's the difference between healthcare and lactation support providers? Healthcare providers are kind of the usual group you think of when it comes to healthcare. The registered nurses, OBGYNs, you have some midwife nurses, you have doctors, physician assistants, where lactation support providers are individuals who receive training specifically in assisting individuals and family in prenatal care, pregnancy, birthing, and postpartum care. And the focus is going to be on things like breastfeeding, maternal child health, and peer support for those who have a child. So something to show that, and it shows up in different ways as far as certification levels. Lactation support providers are going to be usually certified lactation educators, or they're going to be certified lactation consultants. There's even more advanced certifications for that field. But healthcare providers don't necessarily get that level of lactation support training. This is generally something that they'll get when they're doing their when they're going through their schooling, when they're doing some training and certifications once they're placed in their settings, but it's not the main focus of their work as providers. So that's kind of the distinction between those two providers. What we did was we asked both providers about their knowledge, their training, their workplace behaviors, and the patient interactions they have. When it came to the families, we asked both mothers and the families about similar things, mainly around their baby delivery, their own background with breastfeeding, around their knowledge and practices. We asked about the resources and support that they receive from providers, from their families, from spouses, from other community entities. So with the survey, again, it's very heavy on numbers, and we'll talk a little bit about that. We don't want to make it too heavy when it comes to giving percentages, but I'll share some of those today. Alliss, could you take it off with a little bit around the interviews? Talk a little bit about some of those interviews you guys did with community members.
Yeah, so I interviewed families that were currently breastfeeding, and a lot of the questions were, well, obviously the questions were around where did they give birth? That question was important because some hospitals are considered baby friendly and some are not. When the hospital is baby friendly, there's a higher percentage, higher likely chance that they're going to make sure that the mother, the birthing person initiates breastfeeding right after birth. It doesn't matter if it's natural birth or a C-section, they make sure that they get their bonding time, education around breastfeeding prior to delivery. There were some that did have experience with education prior to delivery, and then there were some that didn't. There were some questions around support in the community, in their family, and within the healthcare system. There was an overwhelming, no support within the healthcare system. There was support within the family, but then there was some that didn't get the support when it came to breastfeeding in public. So that was a whole nother conversation that we had to have. And that's a whole nother thing that's happening now, where we're trying to normalize breastfeeding and normalize feeding in public. There were also questions about whether or not they were offered formula and if there was any education around formula, how to prepare it. And there was a good amount that were offered formula, but also not told how to prepare it or what kind of formula is good. And the question at the end was, if you had another child, would you make the same decision around breastfeeding? And the answer was always yes. And majority of the reason is because they understand the nutrients that comes from the milk and the bonding time. There's nothing like it. Overall, the bonding time and understanding the nutrients that they are receiving and that they are giving to their child as well. It was emotional at times, hearing the stories about how they didn't feel supported and things they wish they could do differently. But now that their voices are out there, I'm so excited and happy to have been a part of, this key part of the project, because I do think that it's important to put a name and a face with those survey experiences, because it's real. Doctors and healthcare providers report one thing, but when it comes to the actual knowing of the experience, I'm just happy that we were able to capture that in this report.
Yeah, it's great things. And I apologize, I'm looking kind of off screen because I'm finally getting some links up here. But I think that's the very interesting part about how when we did the survey as well, we had similar questions that overlapped, and the interviews provided more context. That surveys, they're very limited when it comes to how much information and nuance that there is behind some of the responses. And, I know that in particular, that's a tough thing to do in this kind of work, because you're interacting with these folks face to face. and you're hearing the emotion behind it. You know, we see what lack of support, what being in need means, but on paper it's different than being in person. So we saw that was very vital part of the projects to make sure that we're speaking to the people outside of just getting them questions and responses that they can hand back. Um, we'll talk more about that too. In the survey findings, that's something that came across a lot was, the lack of support when it came to even within households themselves. Of course, we've talked about providers when it comes to what was given to them as clients. And, ultimately, we do want to reduce the stigma behind breastfeeding in the home, out in the community. We want to increase the amount of access to resources and to culturally responsive resources in particular, because there's not a one size fit all when it comes to giving care. And that's something that unfortunately a lot of health systems, I think, are a little bit outdated when it comes to providing delivery care in that way. It can be innovative in some places when it comes to doing things more online, especially with COVID. Now we have more telehealth, but even then, it's not quite enough to solve such a comprehensive problem that we see when it comes to breastfeeding rates. I do want to say I finally got some links up, so I'm glad about that. So what I'll do is we'll jump into actually some of the findings. So you mentioned some of the stuff that you saw, Alliss, in the interviews. So just some key findings that came from this. This is something that you guys will see in the report once that's available. That Black families, they want to breastfeed, they want to have access to support and services as much as anybody else. Something that we saw was that when it came to healthcare providers who were responding to the survey, they indicated providing less parental and postpartum support for Black clients when compared to white clients. And as I mentioned earlier, the thing that surprised me the most, there's that disconnect between the perceived quality of care when it comes to providers and patients. You mentioned this about baby-friendly certified hospitals. When we asked that question in the survey, nearly half of Black respondents, they knew that they wanted to have their baby delivered or they plan to have it delivered at a baby-certified hospital, compared to 78% of white respondents. Which shows it indicates a disparity in the need for education around the baby-friendly designation, so that Black families understand more about what the benefits are, where you can find them, how to access those resources. They go through a lot more, they have a certification process that requires them as institutions to provide a higher level of care than those that are not considered baby-friendly. So there's a benefit to using those particular institutions. Something else that we saw was that almost not 100%, it was 96% of healthcare respondents felt that they received adequate breastfeeding training to support their patients. But when we asked them around what type of training, only 76% received formal breastfeeding training. So again, that goes back to some of those more certified training programs that are available to folks who do lactation support. And of those who actually receive formal trainings, 24%, a quarter of them said that they received it just during a class in their medical or nursing school practices, which often is not going to be long enough and not as comprehensive as someone who gets certified specifically for that skill set. When it came to lactation support respondents, something that was interesting was over 2/3 disagreed that there was adequate breastfeeding support services in their communities, specifically for individuals of color. Which, again, highlights that the lactation support providers see there's an increased need and diversity for lactation field providers and particularly culturally responsive supports. You mentioned this earlier too, Alliss, when it came to receiving support, social support as a Black individual looking for these kind of services. Black respondents reported having less social support from their spouses, their families, from employers, from schools, than their white counterparts. And I think that there's a cultural, there's a cultural context to that where, and I think this goes across a lot of communities, particularly the Black community. When it comes to breastfeeding in public spaces, there's a need that we have to have when it comes to shifting some of the community and cultural norms that will help destigmatize that practice, that it shouldn't be seen as something shameful or something that is sexualized, that it needs to be seen as a means to feed baby, to increase bonding between mother and child whenever it needs to be done, and that there's no set place that's right or wrong to be able to do that practice. Did you have any thoughts so far about those results? Anything that maybe is interesting? I think in particular the training of providers is interesting when a lot feel adequately trained, but not many have much formal training. Anything there, Alliss?
Yeah, I learned early on in my career in lactation that healthcare providers, especially like OBGYNs and pediatricians, only had like like one class. And, that one class is really not sufficient enough to, be able to provide that type of support. It's like, yeah, you get the basic information. And it's like, again, something that you're checking off of the box. But at the same time, it's not a requirement. So even if you are going into whatever medical field in women or children or families that have kids, it's not a requirement. It's an elective. It's like when you go to college. My elective was debate. Do I like to debate? No. Did I find it useful for my career later? Yes. So I took it, but it wasn't a requirement. So I just feel like it's mind-boggling that it's not a requirement when it is a essential part of nutrition for the child and for the mother. All of the benefits, how it counteracts diseases and cancer, and it builds each immune system. It's just and the fact that they checked off on the survey that they felt like they got sufficient education and information, but when you feel it when you're the counterpart and you're on the receiving end and there is no support or education, it's like, what's the point? And also in these practices, it's so important for there to be a lactation support person that has gone through the training. My first training was a week long, 8 hours a day, 5 days a week before I got certified. My second training was 8 hours for 3 days. My third training, again, 5 days, 6 hours. I've been through so many trainings just to make sure that I stay current on information and to make sure that I have the type of certification that is, adequate to provide the support. So, sorry, I went rambling.
No, I appreciate it. I want to say apologies to everybody. I know we started a little bit later trying to get set up. We're ready at 12:30, but at least if it's okay with you, we can go a little bit more over just to kind of still give more context about what came out of this report. That's right. Okay, great. Thank you. I'll try to move through some of it. I think in particular, something that came from what you said, came out of the survey was around human milk versus formula milk, formula. And that's something that was surprising that we had over, we only had, wow, it was amazing. We only had about 36% of healthcare providers who agreed or strongly agreed that there were fewer health or growth concerns with formula-fed babies than breastfeeding babies, which of course, again, it surprises us. Research has indicated that human milk is more beneficial for the baby's development, its immune system, as you mentioned, helping the mother as well with her body and health as well. It's not just about the baby when it comes to the milk. And a third of healthcare providers thought that having breastfeed babies were harder to care for than formula.
Yes, that was
crazy. It's scary to think about how, again, it's, we have a lot of providers that might not be too knowledgeable around around the benefits of human milk and really promoting that. And in case, other than, I guess, in the circumstances where women might not be able to naturally produce the milk, that should be always an alternative that should be promoted, should be recommended. Information should be given to mothers as well, so that we can have more of that initiate, but also more of that continue to breastfeed up to the recommended amount of time that they have for newborn babies.
I just wanted to comment really quick about the formula versus human milk. There was another question that I asked during the interviews is whether or not donor milk was offered, because sometimes there is a point, there is a period between giving birth and when the milk actually comes in. And there is a donor milk bank here. It's the largest in the country here in Colorado. It's in Arvada. It's the Rocky Mountain Mother's Milk Bank, where you have the opportunity during that first couple weeks period where you're waiting to, have your milk fully come in and you're getting adjusted, trying to, navigate this new thing that's going on with your body and your baby, there is an opportunity for you to receive still human milk without going to formula first. And so one of the questions is like, was that even offered? Was it an option? And a lot of people said no, they didn't even know it was an option, and it is an option.
You know, that's amazing you said that, because that's one of the things I was going to talk about next was the healthcare experience, experiences with providers from the Black client's perspective. And, you know, we talked a little bit about how providers have a certain level of education, and it's usually through these certifications, but they have a certain amount of experience with providing information, resources, and even methods for families to use with breastfeeding. Healthcare providers are much more likely to get patients referred to them from other healthcare providers, while lactation support providers were more community-based, they're more community-serving, and their referrals came from a wide range of sources. So again, that kind of highlights that there's a healthcare system where you don't get a variety of different professionals with expertise interacting with community members. Most folks have babies delivered in a hospital, not at the home setting. So, you know, so there's an opportunity there for healthcare settings to have more of these lactation support providers intertwine into the work, being hired, or rather being the referrals to community members once they leave the hospital. That's something that we see as an opportunity. One thing that you mentioned about the experiences of providers. So when we did our survey, 100% of healthcare providers stated that they regularly ask clients, all their clients, about breastfeeding. But in a separate question, we asked those same providers, I'll word this way. In a separate question that we asked, 26% of providers said that they don't always ask, or they're unsure if they always ask about breastfeeding if their client is Black. You know, again, that shows that there might be a perception that I do this for everybody, but when we start asking about certain community members, we might not see that confidence level as high, and particularly from the patient side, that a lot of times that validates, but the providers themselves showed that a lot of times they're not, when they compare to white counterparts, they're not often given the same information, the same referral sources, not spent as much time dealing with an issue that might be around breastfeeding in particular. And only 70% compared to 88% of Black respondents actually said that their healthcare provider actually offered breastfeeding support services. A big disparity when you look at just between Black and versus white patients. So anyway, I love your thoughts on that. I think after this, we can go into the next steps that came out of the report. There's three that we identified as things that both organizations and individuals can do to help improve the breastfeeding landscape. But anything around that, anything more around some of the experiences that community members have with providers?
Just to respond off of what you just said, there was a, majority when you asked, did your provider ask you how you want to feed your baby? They would say yes, and that's it. Like, yes, do you want to breastfeed your baby, or have you thought about how you want to feed your baby? And yes, okay, you might respond breastfeeding, okay, and that's it. Or they may respond, yes, I want to feed them both ways, with formula and breast milk. And that's okay, that's fine. And then, the response might be formula. And then they're like, okay, that's fine. Here's some coupons. Here's a pamphlet on where you can get, formula, or here's the coupons. You can sign up on this website so you can get discounts on formula.
So, and that's, again, concerning when human milk is not seen as more beneficial than formula, which outside research actually suggests. And the fact that providers might perceive formula-fed babies as easier to deal with.
Yes, that part. Providers have said that it's just easier that way. It's easier to deal with because, like, if they're, they know they're going to gain weight, they know they're going to eat, they know they're going to stop being fussy, when in all actuality, it's quite opposite. I can go into it all day, but let's get back into the findings.
Yes, I know we've been, you with the project team and us, we talked about it at length, and it's amazing. I learned so much from you guys, especially in our state partners at CDPHE. You guys taught me a lot about the formula industry and things that I was not aware of, and but yeah, and it's very interesting how it's very much infused in healthcare settings. So yes, so what were the things that came out of this? When we think about next steps that this report and the insights that it brought for us, what does those next steps look like? Well, there was three main ones. I'll just take them to point by point. At least feel free if there's anything that you want to interject with, feel free to. So the first one, we talked about some of this over this whole conversation. The first one is having advanced training for healthcare providers and to build capacity, build the capacity of the community lactation for workforce. So what does that mean? That means that, again, when it comes to advanced training, we mentioned that there's a lot of healthcare providers that are the main source of service providers to community members regarding breastfeeding, maternal health. But they don't necessarily have the advanced training that lactation support providers have. There's a disparity there when it comes to being well equipped to deal with some of the issues that are unique to mothers and those who are birthing. So we want to talk about some of the things I said. We noticed that when we asked providers about what were some of the barriers to getting more certification, specifically around lactation support, main thing, no surprise for most folks, is that there's financial barriers to getting certified. Certifications and recertifications cost money. Training materials can cost money. You have to spend hours. You can spend hundreds of hours in training settings, trying to have mentoring hours to be able to gain some of these credentials. Those are barriers that persist in the field. Another thing about building capacity in the community lactation workforce is to increase the racial and cultural diversity of the workers themselves. Something that's always been a problem when it came to the workforce, healthcare experiences, is that not having that cultural matching with your provider. Having a provider that may not understand you because of your cultural, religious, your racial, ethnic background. They might also have implicit bias towards you that impacts your individual care. We know from research that this is something that systemically happens no matter what. As an individual, it can impact you as well, depending on your experiences. I'll say number two is around community breastfeeding, and that's really access to education and support. We talked a lot about it. When it comes to advocating for more breastfeeding healthy practices, more education in the Black community, that's going to help increase our ability to do things for ourselves when it comes to preventative measures, helps us increase access for community members because they don't have to go through healthcare systems necessarily, and helps reduce the stigma and helps with making people feel more comfortable doing this and being more supported. And you are someone who, even if you're not a breastfeeding, chest feeding person yourself, you're actually able to support someone who is. Around community breastfeeding as well, working with community level entities. That's the nonprofits, that's the different health centers at the local level, places like Family Food Forward's Resource Center. We also have the Black Breastfeeding Coalition of Colorado. They were our partners as well on this project. They are a collection of providers, lactation support providers, advocates, researchers that are involved in understanding what we could do to move the scale when it comes to improving Black breastfeeding rates in Colorado. Going to community level entities can be some of the most accessible ways to get it, although not always, not always staffed with the most resources, which is another thing that needs to be advocated for. It can be some of the most compassionate and I'll say most effective providers you can run into. Their care is more one-to-one and a little bit outside the constraints that healthcare settings can bring to the interaction. And then number three is, again, when it comes back to advocacy and making changes at system level. So it's policy and systems work. So really what this report has helped to inspire when it comes to the people who run the systems and work within them is to explore where is it within their system, within their organization, they can have policy changes that will contribute to all the things we mentioned before, like increasing the hiring of non-registered nurse, certified lactation specialists in hospitals. Most of the folks are going to be have interactions when it comes to the breastfeeding setting in hospitals. A lot of them are registered nurses. So how do we get folks who have different expertise into those settings where they're going to be able to interact with more community members? Also, how do we advocate for changes when it comes to how we do care coordination? For those who are not familiar, care coordination is being able to go to a point of entry into the different systems and resources that you need. So for example, if I'm looking for understanding how I can support, say, my spouse with breastfeeding, I can go to a community organization like Family Forward Resource Center and I can take a class. I can have them actually just tell me where there's trainings, where there's resources that can help me better understand how I could be more involved. And care coordination when it comes to hospitals versus the community level sometimes could be disconnected. And that's where we start running into issues where you're not able to know about everything available to you as a community member. There's a lot of community level resources that exist. We help support them by participating in them. It helps advocate for more funding, the expansion of those programs as well, which is important for them to do the services they do. When it comes to organizations, those are perfect referral partners that can help with offloading some of the strain that a healthcare system could have by trying to take some of the requests that they may or may not be well equipped to at the moment to serve. And then again, hiring practices, bringing those that have more advanced lactation training into the field so that they can increase families' access to these services. Those were the three key ones. I was going to move into resources. Alliss, is there anything you want to say about those 3 findings?
No, I think you hit the nail on the head.
Okay, perfect. Okay, so I know we're going way over than we usually do, so I appreciate everybody hanging on, and feel free if you jumped off, you can always access this video and catch back up on some of the things we're talking about today. So I'll briefly mention some resources that we want to make you guys aware of. Some of them we do actually have links for in the chat for you. So it's always a safe bet to check out different state and local government resources. One in particular we want to mention, of course, is Colorado WIC, that's for women, infant, and children. We'll link the WIC's webpage to resources and education they have around breastfeeding, pregnancy, and how to keep mom and baby happy. Also, and sometimes it's a simple online search engine. Just go and look for community-based organizations that are nearby you that seem to have the type of services that you want. Reach out to them. There's a lot that provide different maternal child health services, ones that work on parenting programs that can involve multiple generations in the household, and of course, both parents. Lactation support services, a variety of different things. Family Force Resource Center is a longtime partner of ours that we've always referred folks to because they've always done great work, and particularly when it comes to serving Black community members in a responsive way, and I would say an accountable way. And then last I'll mention is that there's a lot of different business directories, resource guides that are available out there. One that I will highlight is the Colorado Black Health Collaborative. They have a great community resource guide that they put out. I think for the most part, it's every 2 years or so. Updated resources on a variety of things around health and wellness. But in particular, they have healthcare providers, they have doulas, they have midwives, they have community-based clinics, all listed in there. A great resource that I refer people to a lot. We'll just, I guess we'll end it at that. I don't see any additional questions in the Facebook chat right now. I guess before we close out, Alliss, is there anything else that you want to say to the audience before we close out?
No, not really. I just, anybody listening, if you have any further questions about what we discussed today in the report, always feel free to reach out to Center for African American Health or Families for Resource Center. And we will be happy to support you and answer any questions and help guide you. Yeah.
That's great. Thank you, Alliss. And thank you for co-hosting this with me. We're excited to let folks know about a lot of the stuff that we're going to be having. We talk about maternal health in particular. Again, we have mammograms coming up on February 12th at our building. So feel free to join us for our first installment of our annual health fair. To that, anybody has any questions, feel free to leave us a question here in the chat or send us a direct message on Facebook, and we'll get back to you on those. Other than that, we'll close out the day. Hope you guys all have a great, safe weekend. Stay healthy. Alliss, you as well. Take care, and thank you so much for all your work and your partnership on this.
No, thank you so much, Eric. And you stay healthy, stay warm, and thanks again for everything that you have done on this project and all that you're doing at Center for African American Health. Your partnership is truly appreciated.
Thank you. Thank you. Likewise. All right, well, take care, everybody.
Bye.